rely on what somebody else has written on a piece of paper for you. All right? That's where people mess up sometimes. Is they go by what somebody else gives them and they think that's all inclusive. And it's not. You're responsible for your own learning. Okay? Y'all understand what I'm saying?
Yes.
You don't want to go out of here saying, well, it was on my notes. Well, those notes were not your notes. They were somebody else's. And people don't see the same things. They don't hear the same things. So just make sure that you study on your own merit, not somebody else's. Okay? All right. I know we're going to go ahead and talk about HIV/AIDS, and then we're going to take a break, and we'll come back and see as far as we can get today, and then we'll do the rest tomorrow. All right? But we've spent a lot of time on this because I feel like it's important for you all to participate in this process with this, because hopefully it's going to help you, learn. And I'll try to fill in the blanks as best I can with the conditions. But let's start out with HIV/AIDS is over here. Like I said, I know all of you can't see all of this on the board, but you can listen to what they say, then you can take your own pictures or whatever you want to do as far as getting that information. But y'all go ahead, let's talk about HIV/AIDS for a few minutes. Whoever wants to present.
John Michael, are you presenting?
You can.
Okay, HIV/AIDS is a retroviral. Your CD4 and T cells are low. Your white blood cell count will be low as well. Normal T cells are 500 to 1500. Once they get below 350, you can have treatment. You have several different tests. The ELSA or the EIA is inexpensive but accurate. If you have a positive test like of that, then you'll have the Western blot test to confirm a positive. Follow protocol on reporting the proper agent. What is that? Reporting to the proper agencies.
It's a mandatory reporting.
Okay. Per facility, state, federal regulations. So if somebody's positive in your clinic or hospital or whatever, it has to be reported to these agencies. Acute HIV mimics flu-like symptoms. You might have a sore throat, rash may accompany it. Gradually your CD4 and T cells, I guess, will decrease, and virals will go up. Your viral load will go up. We want them to have 2 to 3 liters of fluid a day. Let's see what else. There's a heart test also. It reduces the viral load, improves CD4 T cells, slows disease progression. Oh, that's a medication, sorry. Ensure meds are not missed. They have to have at least 90% of their medication. So if they miss 2, then they have to start over. Is that right, Jesse? It just doesn't work effectively. Okay. Teach to avoid crowds and sick people, which we all know that. Report fever ASAP. The drug stop replication of the virus, but does not cure it. She said that already. And their diet's going to be high protein, high calorie diet.
Okay. All right. Now, when a person reaches what level on the CD4 count do they get a diagnosis of AIDS?
200.
It's less than 200, right? Okay. They mentioned up here if it's below 350 is when they normally will start the treatment. But what you need to remember about treating people with HIV, once they start those drugs, they don't take them off of them. So they want to make sure when they start them, that's the time to start. Okay? As far as, missing the medications, they have tried all kinds of things to make sure that people don't miss their medications, because if they do, that will allow that virus to continue to replicate. All right? And the reason that they give more than one type of drug for HIV is so that that person does not become resistant to that and doesn't help them anymore. So they normally would start out with more than one drug And even nowadays, they have a lot of these drugs that are like 3 different actions in one pill. And that will help with compliance for one thing. You know, it also is less expensive for them if they are able to buy 1 pill instead of 3, and they get 3 actions in 1 pill. So that has helped people be more compliant and get that at least taking their meds most of the time without missing them. As nurses though, if we are given these medications, it's important for us as nurses to remember that these folks have to have these meds on a regular basis, and we can't just, because they went to have a test done, we can't ignore the fact that they needed that pill during that time. So if you have a patient who is, say, in X-ray, when it comes time for this med, if they're gonna be there for any length of time, what would you do? Pardon?
You go and give them that medicine. No.
You go give them that med if you can, absolutely. If you can take that med to them and give it to them in X-ray, if there's no reason for them not to have it by mouth at that moment, then yeah, by all means, just don't skip it. See, as nurses, we have to be cognizant of that with meds, and especially with HIV meds, because they don't need to be missing these drugs, because that would open them up for an increase in takeover of those CD4 cells.
Is it time sensitive? Like, could you hold it till they came back, or you need to give it?
Well, you know, you can hold it for a certain period of time, a realistic amount of time. If they're gonna be back within the hour, you know, when y'all give your meds at the hospital, you got an hour either way, right? Most of the time, that's how it's kind of set up, all right? But if this person's gonna be gone half the morning, then that's not a good idea to hold that drug for 4 or 5 hours. I mean, it's gonna get them off their schedule, right? And so you just want to be cognizant of that with HIV drugs.
Another thing that we did put up there to be cognizant for nursing interventions and stuff, counseling the negative tested family members and whatnot, or especially their sexual partners, because there is now pre-exposure prophylaxis or Truvada, and that too, once they start it, they have to stay on it, and it's not like birth control where, you know, you can miss it here and there. That's one that you also, so if you see someone who is admitted and on Truvada, you need to give them that also.
Okay. Y'all got something y'all wanna share? Okay. All right, well, y'all think about this for just a minute. You know, y'all will probably take care of a patient with HIV/AIDS in your career, you know? I know that, in the past, and I may have told y'all this, I may not have, but I took care of a patient that was in home health many years ago that had HIV before we even seen very much of it in Jackson County. And I was covered from one end to the other. There was nothing showing on me at all, because we didn't know what we were up against. You know, we didn't know if we would catch it or whatever. So we learned a lot over the years about that and how you use proper PPE. Okay? All right, guys, some of you need to pay attention. Tell me what is proper PPE for a patient who has HIV/AIDS.
Standard.
Okay.
It depends on what's going on. If they already have a bacterial pneumonia, you'll need to make sure you do droplet precaution, because that's it's body fluids, it's gonna be infected.
Okay, so let's make sure we all understand this. What's standard precautions?
The treatment of any and all excretion as infectious.
Okay, so basically what you gotta do, if you have, a person who you need to take care of, standard precautions is whatever it takes to protect you and that patient, right? It's whatever it takes, all right? It's not just gloves. It's not just a gown. You see what I'm saying? It's whatever it takes in that situation to protect you and that patient, all right? Now, you may add droplet precautions or airborne or whatever you want to call it, contact precautions, whatever. You may add all of that in addition to. But if you've got someone who has some sort of fluids, regardless, you got to protect yourself, right? Okay, just so you kind of understand that. Now, I'm not saying you got to use one of those N95 respirators to go into a patient who has fluids draining, okay? But you do need to be very careful about using gloves and gown, and if you have maybe exposure to anything for the eyes, you would want to make sure that you protect the eyes. We took I don't know if I told you all this or not, but in one of my clinical groups, we took care of a patient who had died with HIV, and they had tubes out of every orifice, you know, that had blood. So we dressed out pretty heavily, you know, to make sure we pulled that NG tube out, it didn't splash back on our face. You know what I'm talking about? So you have to protect yourself depending on that situation. How do they transmit HIV? How's it transmitted?
Semen and blood.
Okay, can they get through breast milk?
Yes.
Okay.
Or they just get it if they did have a vaginal birth.
It's usually just through the mother, through the, they can get it through blood and breast milk during pregnancy. Let's see, what else I want to talk to you about? We talked a little bit about those soft skills and things that you're going to probably have to have whenever you taking care of people who have HIV, and talking about the PPE and such. I mean, there's no reason that you can't touch a person, right, with HIV, unless they've got an open area and you've got an open area. You know what I'm saying? You don't want to be, you know, getting into the fluid situation there. But as far as just going in and talking and sitting down, you know, that's probably one of the best things as a nurse that you can do for any patient. And here we go talking about concepts again. A lot of this stuff we talk about applies to everybody. You know, everybody appreciates the fact that you'll go in and spend a little time with them and listen to what they might want to say. It's not that you can do anything a lot of times about what's going on, but probably over my 40-something years of nursing, that's probably one of the things that I've learned the most from is the fact that people, they like for you to be at least interested in what you're doing and why you're there. And hopefully, just sitting down talking to these people will help them have better outcomes. A lot of them are depressed over their situation, and sometimes just having somebody to be there to listen to them vent, share their feelings, will help them. So y'all just be cognizant of that throughout your nursing career, is that the best thing you can probably do for most of your patients is give them some of your time. Okay? Just go sit down and let them talk. Sometimes that's just what they need. That's the best type medicine that they get. Tell me some of the things that they mentioned up here about the diet. All right, what kind of foods would a person that's immunocompromised avoid? Okay, so any kind of raw foods, raw fish, raw. What kind of fruit? Fresh fruit. Okay, can they have cooked fruit?
Yeah.
Okay. But the fresh fruit, what's the problem with that?
Bacteria.
Where?
On it.
On the skin, right? Okay. And y'all know, we've also talked about making sure, somebody mentioned back there, making sure the steak's cooked well, the meat's cooked well. Can they have canned fruit?
Can it have bacteria?
Can they have canned fruit? Is the question. Yes, they can. Okay. All right, because that's been processed, right?
Okay,
That
so
has
it's
been
not raw.
processed. But it's this raw fruit that we have a problem with, okay? Let's see, what else? And I know talking about this in the past, we've talked about how, people with HIV, any immunocompromised person, all right, let's just say that, anybody that's immunocompromised, they have to be careful about getting outside, working in their garden. Why?
The flowers.
Okay, in the dirt even. That's right. Any of these flowers, you know, we know about taking flowers out of the rooms, right? Changing the water every hour. We know all those kinds of things. But, you know, we just have to make sure we understand even going outside playing in that dirt could give them a problem. All right? And even using gloves is not adequate for that because they could have some breathe-in spores or something that would give them a problem. So y'all just have to think like that. Do we need sterile gloves taking care of these people?
No.
No. Okay. What else as far as preventing infection that they may have in the hospital that would be helpful to them? How are you gonna, like, just think about a person in general that has an immunocompromised condition.
Wear a mask when traveling.
What now?
Wear a mask when traveling throughout the hospital.
Okay. What else?
Least amount of visitors as possible.
Okay. Private rooms. What about the equipment that you use on them?
Stays in the room with them.
Stays in the room, right? So all that stuff kind of stays in there for them. You don't be passing around all over the hospital, right? Okay. I'm thinking of what kind of things like, all right, are these folks that are immunocompromised, they're more prone to an infection, right? Just simply because they're, in particular HIV, their CD4 counts down, right? Okay, so that opens them up for an infection of some sort. Okay, where do we sometimes see them start getting sick? Signs and symptoms y'all mentioned up there. What part of the body do we sometimes see?
Oh, like flu-like symptoms.
Flu-like symptoms, that's respiratory stuff, right? Okay. How can we keep people from getting worse as far as respiratory issues? What would help them? Incentive spirometry. Don't make this difficult, guys. That's what I'm saying. Y'all know how to take care of these people. You know how to prevent an infection. All right? You know what it takes to protect you and the patient. So, don't make it difficult. All right, another couple of things. On the drugs, we talked about the heart drugs earlier today. Okay, I just mentioned that right off the bat so I wouldn't forget to say something about it. The main thing here is that you understand that these drugs, there's a picture for you to understand the drugs yourselves, okay? There is a picture in your textbook that shows the cell, the human cell. And it shows at every aspect during that cell where these heart drugs target. Okay? Use it.
Emma.
Huh?
Emma. Oh. They don't need us.
Okay, all right, so at different parts of that cell is where these drugs work. Like the entry inhibitors, that's gonna stop it at the entrance of that cell, all right? There are different enzymes that these cells make and the HIV virus makes that causes the virus to take over that cell. So there are drugs that are made that inhibit that. Okay? Y'all need to pay attention to me. Okay. I just want you to understand that the whole purpose of this, like you all have different medications that treat blood pressure. I'm talking concepts here. You got different medications that treat diabetes. And you have different medications that treat HIV, AIDS. All right. They all work differently in their own way to stop whatever they need to stop from happening in that person's body. Right? So these heart drugs, different steps of the way of the replication of that virus taking over that cell is blocked by taking these drugs. And that's why sometimes they'll take 3 in one in order to stop it at different places in that process. Does that make sort of sense? Okay. So I just want you to understand, take a look at that cell, take a look at where all of those drugs work, and it'll help you understand how that process is stopped. But I'm not going to ask you to remember where all those processes stop. I'm just asking you to know why that happens, why you take 3 of those. What is the purpose of it? Is to stop the replication of that virus and to stop it from taking over that CD4 cell. I hope that helped with that. You always want to, as I said, you want to assess your client's support system because not everybody has a good supportive family. And like I told you, that's one of the best things you can do for them is to sit down and give them a little of your time. Okay? I have a test for you. I'm going to call out questions. Y'all can answer all at once. I'm not going to make you take the test. I just want to do a little review, and I'm going to give y'all a little break, okay? All right, the first question says, is true or false? Y'all just tell me, true or false. HIV attacks the body by affecting a type of white blood cell called the T lymphocyte.
True.
That's true. See, the CD4 is a T lymphocyte. It's a T cell. And if you'll remember your body's patho, okay, remember that the B cells, the bone marrow, B for bone marrow, they're all in the bone marrow, but some go to the T cells to mature, and that's in the thymus, okay? So it is a T lymphocyte. It's a white blood cell. All right, the next one says post-exposure prophylaxis in response to the exposure of a healthcare person to blood or other body fluids reduces the risk of HIV infection.
That's true.
Once they've been exposed, right, and then they get prophylaxis, is that going to help reduce their risk of HIV? Yes. Yes. Okay, so they may treat them after an exposure, right? Okay. The next one says HIV belongs to a group of viruses known as retroviruses.
True.
That is true. The next one, the normal ratio of a CD4 to CD8 T cells is a 2 to 1. True. That is true. And that's just the way it is. You've got, 2 CD4s to 1 CD8. All right. The window period is a time during which an HIV positive person tests negative on the HIV antibody blood test. Okay, do y'all understand the window period? Huh?
Yes. Yes.
All right, somebody tell me what the window period means.
It's like if you go out and have sex with an HIV person and then you go get tested like a week later, it's gonna show up negative.
It hasn't built up in
Yeah,
your
it
system.
hasn't gotten.
It
Your
doesn't
body
show
hasn't
exposure.
had a chance, that's exactly right, your body hasn't had a chance to build up those antibodies yet to show up on that antibody test, right? So that's the window. All right, the next one says, when the CD4 T cell level drops below 400, the person is said to have AIDS. Okay, what's the number? 200. All right, testing for HIV is complex, requiring interpretation, counseling, and confidentiality. True. That is true. All right. The EIA, or the ELISA test, is used to confirm seropositivity when the Western blot assay is positive. That's false. That's
It's the other way
wrong.
around.
Okay. The viral load is useful in monitoring disease progression and treatment effectiveness.
True.
That is true. The viral load, that shows how much virus is in that blood. And if it's less, then that means your treatment's working, right? Okay. All right, the last one. Nursing assessment includes identification of potential HIV risk factors, including a history of risky sexual practices or HIV drug use.
True.
That is true. That's a nursing assessment. All right, y'all take it back 10 minutes and we'll come back.